Hello, Dr. Keith Smith here at Surgery Center of Oklahoma with you once again. In a previous video blog, we talked about the electronic health record scam. And I indicated, sort of teased you at that point and told you I would get back with you and tell you why the federal government was happy to be part of this. Happy to subsidize this. The physicians were told that you must buy these medical record systems or your Medicare payments, and the ones to the private practice physicians were already bad. And they were told if they didn't buy these systems that their Medicare payments would be cut. So it essentially mounted to a mandate, and the government mandated these medical records. And then they told the doctors, but after you spend all this money, you can get all or part of it back, as long as you send us all the information that you collect in these electronic medical records. In other words, you betray your patients and you can have your money back. These medical record systems are not cheap. And so this lure to subscribe to this scam and adopt these mandated electronic medical records was really irresistible for many physicians. The ultimate reason that the government was instrumental in mandating this was it was a payoff. They had been basically, the officials had been bribed. I mean, not to pick words lightly, but this was a bribe from the electronic health records industry. No different than everything else that goes on in Washington, D.C., but that's what it was. I'd indicated earlier there was a market for these records, and there is. They do have their use, but the market not being as big as the folks who made these records, not being big enough for them, they thought that they would just get the federal government to come in and mandate their purchase. So the government adopting and mandating the purchase of these records was simply delivery of a promise to those who had paid them so well to mandate this. Another reason that the government was happy to do this is that the federal government has systematically been involved and instrumental in the slow but sure targeting and destruction of the private practice of medicine. Private practice physicians like me, like those who are not hospital employees, are not going along with many of these schemes and scams that the supposed well-intentioned folks in Washington come up with. So the fewer of private practice doctors that are out on the street, the better. Having these physicians, forcing the physicians to buy these medical record systems made many physicians throw up their hands and either retire altogether or succumb to the pressure from the hospital systems that wanted to hire them, and they were much more amenable to an offer they otherwise might not have taken from one of these hospital systems. Another reason, and another bit that these medical record systems were adopted by the federal government is, as I said, a payoff to their hospital pals. This allowed hospitals to hire doctors, and also to allow the hospitals to buy out their competitors. And the hospitals also were very interested in these medical records being adopted. But the ultimate reason is the truly scary one. The government wants this information. I mean, they want everyone's health records. They want this for a couple of reasons. Information is power. I mean, the data that has been collected already pales, of course, to what will be collected over the years. But the government wants the power of having everyone's health records. Ultimately, they want this power because they want the power of rationing. As more and more people's health care becomes the business of government, then the government will feel their budget swell. And they know this. I mean, eliminating pre-existing conditions as a policy for insurance companies means that people can essentially buy homeowners insurance when they already know their house is on fire. And you can imagine what that is going to do, and has already done to some extent, to the premiums for insurance. If the government knows what everyone's pre-existing conditions are, if they know, for instance, in a certain zip code that a few people have very expensive conditions to treat, then all they need to do is use their new independent payment advisory board to ratchet down the payment to doctors and facilities so low for the treatment of these conditions that these basically lines will form. People, doctors, and even facilities will be reluctant to take people on at reimbursement rates that are below their cost. This is impossible to do without having the data to know the zip codes and the area codes and the addresses and the medical histories of people who might be too burdensome for the system, and they can be much more easily targeted by the federal government when they have their ultimate dream, and that is when they're in complete control of the healthcare system. You can see that in countries that have single payer systems that's exactly what they do. They balance their budgets by using rationing. And I think that the central planners know that is how this is headed, and they have to have the power to ration. Otherwise, the healthcare costs truly will exceed any of their wildest dreams, and the taxation required to sustain it would just not be politically tolerated. I wanted to give you some background on why the government was such a big fan of this, and this is all depressing and horrible stuff, but it's also something that not very many people are talking about, and I think it's very important to understand. Thank you. We'll see you next time. Check out our website, surgerycenterok.com, to learn more about free markets and healthcare. See you next time.